I'm Jessica Schubin, nurse and asthma educator with Breathe, Pennsylvania. Our mission is to empower Western Pennsylvanians to breathe better and live healthier through education and awareness of lung health in our communities. Today, I wanted to talk to you about an important subject, asthma. Maybe you, a family member, or a friend has asthma, so it is very important to listen because you never know when you may be able to help. Asthma is a chronic obstructive airway disease. This means there is an issue with something that blocks the tiny airways in our lungs and causes us to have difficulty breathing. To understand asthma, we must first understand how we breathe. First, we start with a tiny oxygen molecule. We breathe it in with our nose and our mouth. The oxygen travels down our main windpipe or trachea into the large airways into two lungs. The oxygen continues to travel into a small airway that finishes in the air sacs or the alveoli. This is where oxygen makes its exchange with carbon dioxide, sending the oxygen all over the body, while the carbon dioxide travels back the path and we breathe it out. Those small airways is where asthma happens. When we breathe in an asthma trigger, such as an allergen, pollen, dust, or pet dander, or an irritant like smoke or a strong scent, the airways react, causing difficulty breathing. 3 changes occur in the airway. First, the muscles around the airway squeeze or tighten. When this occurs, it will make the airways smaller and we may start to wheeze. Second, the airways will start to swell or puff up, again, causing the airway to get smaller, making it harder to breathe. The third change is our lungs create more mucus. This is a slimy, sticky substance that is normally in the lungs to protect them. But with asthma, the mucus increases and we start to cough to get it out. Our bodies are super smart, and when these changes happen, it tells us something is wrong, with early warning signs or body clues. Remember that cough or wheeze we talked about? Those are definitely signs that we need to take our inhaler. We may have quick, short breaths, or our heart may beat real fast, which just means that our body needs more oxygen. But sometimes our body clues don't always look like asthma. We may have a stomach ache from coughing up and swallowing the mucus, or we may feel very tired because we need more oxygen, and that's what gives us energy. When our bodies start to show these clues, it's very important to act. We need to take our inhaler. When this happens, it's very important to help your friend or family member to make sure their airways are open and they're breathing properly. When you have asthma, your doctor will prescribe an inhaler called Albuterol. This medicine, when inhaled with a spacer or chamber, will send medication straight to the lungs and in 3 to 5 minutes make those muscles that are so tight relaxed and happy. But sometimes we need to take a medicine called a controller, and it does exactly that. It controls our asthma. It helps with that puffiness in the airways or that increase in mucus. It helps to keep it, funny enough, controlled. That's why we call it a controller. These medicines are very important, the controller, when prescribed that you take them every single day or per your doctor's orders. It is important to understand that for some people, asthma is very minor. You may never know your friend has it, but for others, asthma can be a major problem and really interfere with someone's daily life. It may even lead to a life-threatening attack. Asthma cannot be cured, but its symptoms can be controlled. And because asthma often changes, it is important for you to work with your asthma team to track your signs and symptoms, and they'll adjust your treatment as needed. Let's be honest, breathing is a really important aspect of life. And when someone is having trouble, it can be really scary. And having a better understanding of asthma can really help when someone's in need. For more information about Breathe Pennsylvania's programs and services, or further education about asthma, or to download your own Asthma Action Workbook, please visit www.breathepa.org.